Today, we will discuss a study on the efficacy of using zolpidem in conjunction with antipsychotic drugs to treat schizophrenia.
Benzodiazepines and Z-drugs are positive allosteric modulators that increase the affinity of GABA to postsynaptic receptors. Increased GABA activity causes the cell to fire more and indirectly affects dopamine-releasing neurons.
Benzodiazepines are often used to treat symptoms of schizophrenia, like anxiety and agitation. They are also commonly used as a treatment for insomnia. Z-drugs are non-benzohypnotic and sleeping aids that act similarly to benzos on GABA receptors. They are sometimes used in conjunction with typical antipsychotic treatments. However, there is very limited clinical and preclinical data to support its efficacy.
Z-drugs are also supposedly less addictive than benzodiazepines. Studies on the effectiveness of benzodiazepines for treating the symptoms of schizophrenia have conflicting results. They are used to eliminate motor disturbances caused by antipsychotics, but questionably efficient at being their own form of an antipsychotic. A study by Wong et al., a single case report, concluded that zolpidem augmented the effects antipsychotic drugs have in a treatment-resistant schizophrenia patient. In a case by Mirzajewski et al., it was showed that zolpidem, but not benzodiazepines, induced seizures accompanied with a loss of sensation and rigidity at high doses. This was able to be reversed by giving the patient a D2-D3 agonist, quinperol, which indicates that zolpidem acts as a sort of neuroleptic, or calming, depresses nerve function sort of effect.
Developing schizophrenia is associated with dysfunctional GABAergic interneurons innervating excitatory glutaminergic cells in the prefrontal cortex. Most post-mortem studies of schizophrenic patients demonstrated that the patients had less GABA-generating enzymes, and it has been shown that antipsychotics like haloperidol and clozapine can increase the expression of GABA-generating enzymes.
The aim of this study is to investigate the effects of zolpidem as an antipsychotic in rats compared to the drugs diazepam and risperidone, which is a second-generation antipsychotic. It also aims to investigate the extrapyramidal effects, i.e. movement disorders, of zolpidem. Amphetamine and MK801, diazepam, induced hyperlocomotion and amphetamine-induced prepulse inhibition deficits were the models used to investigate the efficacy of the three drugs as antipsychotics.
The animals used were adult male Wistar rats, all weighing 150 to 400. The animals used were adult male Wistar rats, all weighing 350 to 450 grams, and kept 4 per standard plastic cage and kept in a constant environment. Groups of 6 to 8 rats were given varying amounts of the three drugs, and their behaviors were scored by a computer system for locomotor activities and led by experimenters who were blind to their treatment conditions.
Testers used an open field experiment, startle response using prepulse responses, stereotype behavior induced by apomorphine, and a bar test as different experiments to test the impacts of the drugs.
So the findings of the experiment were that, I don't know, dude. We're gonna have to cut this. Should I just start at rats?
Yeah, well, you can say that this was like the open field experiment. Also,
Okay,
that
for
lady
the
came over and told us to
open
quiet
field.
down.
What?
That lady came over and told us to quiet down.
Well, we can't use the room.
I know. And there's only one person in there. Wait, are those rooms open?
They're not closed.
Thank you.
They don't have a ceiling.
Well, that's stupid.
No.
This isn't a quiet floor.
Yeah, it is.
That's like supposed to be.
I thought it was supposed to be. Not a quiet.
It's not.
Yeah.
That's
It's not.
what I said.
Yeah.
Anyways. I think we should keep that in. I think people would love it.
In the open field experiment, wait, we're not doing that one yet.
What do you mean?
Aren't
Isn't
we
that
on
where-
bar test?
No. What?
Wrong
Wrong
page.
Wrong page.
In the open field experiment, rats were placed in a large empty arena made from 4 octagonal cages and allowed to explore their environment for 30 minutes under dim lighting and with white noise in the background. Their forward locomotion was what was measured in centimeters per 30 minutes using a computerized system. There were 3 different experiment groups. For the first experiment group, rats were injected with saline 15 minutes before the test began. In the second group, they were injected with D-amphetamine 15 minutes before the test, and in the third group, they were injected with MK801. In each group, there was a different rat given risperidone 60 minutes prior to the test, one with zolpidem 30 minutes prior, and diazepam 15 minutes prior, so the effects of each could be determined.
For the startle response experiment, the setup involved 8 identical chambers containing a plexiglass cylinder against a plexiglass frame inside a sound-attenuated enclosure. There was background noise present via loudspeakers, which were fixed 24 centimeters above the enclosure. Startle responses were able to be detected via a piezoelectric transducer below the frame. These responses reflected the motion of the rats in the cylinder following the acoustic stimuli. Response recordings and sensitivities were controlled by computer software. Sound levels in the chamber were monitored by a sound meter. Test sessions began with a 5-minute acclimation procedure, which involved 3 startling stimuli at 120 decibels for 40 milliseconds, 10 with a pre-pulse stimuli at 84 decibels for 20 milliseconds, 10 with only a pulse or startle stimulus at 120 decibels for 40 milliseconds, and 10 with pre-pulse and pulse stimuli, which included a 20 millisecond pre-pulse stimulus at 84 decibels, followed 100 milliseconds later by a pulse stimulus of 120 decibels for 40 milliseconds. The startle responses were recorded for 100 milliseconds after the last stimulus was given in each trial. With each test type, the startle amplitudes were averaged across 10 trials. To assess the effects of the different drugs on the baseline startle responses to the 120 decibel pulse stimulus, the drugs were administered with an amphetamine vehicle in a series of control experiments. To assess the effects on amphetamine pre-pulse inhibition deficits, the drugs were administered in combination with the amphetamine. Risperidone was administered 60 minutes before the pre-pulse inhibition test, zolpidem 30 minutes, and diazepam 15 minutes. Amphetamine at 6 mg/kg was administered 15 minutes before.
For the stereotype behavior test, rats were placed in glass observation cages and given 0.6 milligrams per kilogram apomorphine. After 20 minutes, a recorder observed how many times the rats would lick, bite, and sniff downwards for a period of 5 minutes. The rats were then given risperidone, zolpidem, and diazepam 60 minutes, 30 minutes, and 15 minutes, respectively, before the observation. The aim of this experiment was to note the effects of the 3 drugs on apomorphine-induced stereotype behavior.
The bar test and catalepsy experiment, rats were placed on a smooth table with a wooden bar fixed 10 centimeters above the surface. The rats were placed with their hind legs free on the table and their forelimbs hanging over the bar. They were then timed to see how long it took them to touch the bar with both front paws, up until the cutoff of 180 seconds. Rats who did not move their front paws but exhibited exploratory behaviors, such as moving their head, were not considered cataleptic. Different groups were injected with various doses of risperidone, zolpidem, and diazepam, and were tested for cataleptic responses 30, 60, and 120 minutes after the injections.
The 3 drugs dose-dependently suppressed spontaneous locomotor activity. The minimal effective dose of diazepam was 3 milligrams per kilogram and 1 milligram per kilogram for risperidone and zolpidem. I forgot to say diazepam. Should I start over?
Maybe.
The three drugs dose-dependently suppressed spontaneous locomotor activity. The minimal effective dose of diazepam was 3 milligrams per kilogram and 1 milligram per kilogram for risperidone and zolpidem. However, the highest dose of diazepam, 10 milligrams per kilogram, caused marked ataxia and myorelaxation, and strongly suppressed spontaneous motor activity in the open field. Amphetamine greatly increased the locomotor activity. However, this effect was able to be reversed with low doses of risperidone and zolpidem at a minimal effective dose of 0.3 milligrams per kilogram. Diazepam was able to suppress the effects of amphetamine at the highest dose of 10 milligrams per kilogram. MK801 was also significantly increased the locomotor activity. Again, though, it was able to be reversed at 0.3 milligrams per kilogram of risperidone, 1 milligram per kilogram of zolpidem, and 10 milligrams per kilogram of diazepam.
Just to be clear, those were the findings for the open field experiment, and the findings for the startle response test were as follows. The prepulse inhibition, prepulse inhibition is a phenomenon in where the amplitude of an acoustic startle response is reduced by a preceding weak acoustic stimulus. It is thought to reflect the operation of sensoromotor systems in the brain, and is something deficient in schizophrenic patients and in animals treated with dopamine receptor agonists. When given alone, zolpidem and diazepam were able to significantly influence baseline startle responses in the PULSE trials. Zolpidem was able to decrease the startle response, while diazepam, at the lowest dose, increased it. The highest dose of diazepam, at 10 milligrams per kilogram, tended to decrease the startle response, but the trend didn't reach significance. Risperidone didn't have any effect on the responses for the PULSE trials. However, for the pre-PULSE trials, it was able to potentiate the baseline. Zolpidem and diazepam didn't have an effect in the pre-PULSE trials. Amphetamine decreased the magnitude of the pre-PULSE inhibition. Risperidone and zolpidem were able to reverse amphetamine-induced pre-PULSE inhibitions with a minimal effective dose of 10 milligrams per kilogram. Diazepam, however, was unable to reverse it at all.
So, in the findings for the stereotype behavior test, risperidone at a minimal dose of 1 milligram per kilogram and zolpidem at a minimal dose of 3 milligrams per kilogram were able to dose-dependently counteract apomorphine-induced stereotypes. Diazepam was able to only reduce the apomorphine-induced stereotypes, but at a dose of 10 milligrams per kilogram, which also caused ataxia and strongly suppressed locomotor activities.
The findings for the BAR test. Risperidone and zolpidem were able to induce dose-dependent cataleptic responses, with their max effects peaking between 30 and 60 minutes after the drug administration. Diazepam was unable to create an effect, with doses going up to 30 milligrams per kilogram.
Hyperlocomotion and stereotype behavior induced by dopaminergic drugs like amphetamine and apomorphine are thought to be mediated by the postsynaptic mesolimbic and dopaminergic receptors. Thus, the tested drugs in the study may reflect activity in different dopaminergic systems. Because risperidone and zolpidem were able to reverse amphetamine-induced hyperlocomotion without having an effect on spontaneous locomotion or catalepsy, it can indicate a selective suppression of psychostimulant-induced dopamine-mediated behaviors by the drugs. However, there isn't a large divide between sedative and antipsychotic properties of currently used antipsychotics with different receptor profiles, like haloperidol or quetiapine, and it may be unrealistic to expect otherwise.
Diazepam was able to inhibit amphetamine-induced hyperlocomotion at the highest dose tested, which was again 10 milligrams per kilogram. It did, however, produce marked ataxia as well, and was 3 times higher of a minimum effective dose needed to inhibit spontaneous locomotion. This can conclude that the reduction of amphetamine-induced hyperlocomotion by diazepam is a non-selective effect as the result of potent myorelaxant and ataxic properties. The reduction of apomorphine-induced stereotypies by diazepam can be contributed to the same effects. Risperidone, on the other hand, as a second-generation antipsychotic and potent D2 receptor antagonist, decreased the apomorphine-induced stereotypies with a minimum dose of 1 mg per kilogram, which was 3 times higher than the minimum dose for the inhibition of amphetamine-induced hyperlocomotion. This suggests that risperidone has a relative selectivity for the mesolimbic dopamine system compared to the nigrostriatal pathway. Zolpidem was also able to reduce apomorphine-induced stereotypies with a minimum dose of 3 mg per kg, which was 10 times higher than the minimum dose for the inhibition of amphetamine-induced locomotor stimulation. Its minimum dose for reducing the apomorphine-induced stereotypies was 3 times higher than the dose for the inhibition of spontaneous locomotion, which may mean that the sedative effects contributed, at least a little bit, to the efficacy of zolpidem in this behavioral model.
MK-801 is a non-competitive MNDA receptor antagonist, which induces behavioral effects in rodents considered to be correlations of psychotic symptoms observed in schizophrenic patients. These effects include hyperlocomotion, circling, and head weaving. Second-generation antipsychotics antagonist this MK-801-induced hyperlocomotion and stereotype behaviors. Risperidone was able to reverse effects caused by MK-801 with a minimum dose of 0.3 milligrams per kilogram, the same minimum dose for the reversal of amphetamine-induced hyperlocomotion, and 3 times lower than that for the inhibition of spontaneous locomotion. Zolpidem was also able to reverse MK-801-induced locomotor stimulation at a minimum dose of 1 milligram per kilogram, but it was also 10 times lower than that for the induction of catalepsy. Diazepam reversed MK-801-induced locomotor stimulation only at its highest dose of 10 milligrams per kilogram, which produced ataxia and myorelaxation at almost entirely eliminated spontaneous activity in the open field.
This data may indicate that zolpidem and risperidone share a similar pharmacodynamic profile in some models of drug-induced psychosis. They both dose-dependently inhibit D-amphetamine and MK-801-induced hyperlocomotion and reduce apomorphine-induced stereotypies. They both have antipsychotic-like effects without affecting spontaneous locomotion. This differs from diazepam, as it counteracts amphetamine, MK-801, and apomorphine-induced behavior only at strongly sedative doses. Zolpidem and risperidone were also indistinguishable regarding the cataleptic effect of their high doses, which furthers the neuroleptic, i.e. relaxing or depressive, behavioral profile of zolpidem.
Prepulse inhibition deficiencies are improved by antipsychotics, and thus reversal of these drug-induced deficiencies in animals is thought to be useful for coming up with new antipsychotics. Zolpidem and risperidone were able to counteract amphetamine-induced prepulse inhibition deficits, but this was at relatively high doses of 10 milligrams per kilogram. The minimum dose to counteract the induced prepulse inhibition was 30 times higher than the minimum dose for reversal of amphetamine-induced hyperlocomotion. However, the high doses needed to restore the deficits might be related to the high dose of amphetamine used to cause the deficiencies in the first place. The two drugs, while showing a similar profile in some experimental models of psychosis, exerted different effects on the baseline startle responses and prepulse inhibition. Risperidone enhanced the baseline prepulse inhibition and did not alter baseline startle responses, which zolpidem did not do. With that information, it may be viable to conclude that risperidone produces more potent and selective antipsychotic effects than zolpidem in prepulse inhibition procedure.
Experimental and clinical evidence suggests that positive symptoms of schizophrenia and psychotic symptoms in other psychotic disorders are linked to anomalies of dopaminergic neurons in the basal ganglia. A substantial portion of GABAergic synapses in the basal ganglia express alpha-1 containing GABA-A receptors. A high binding density for zolpidem was found in the rat Globus pallidus, and zolpidem enhanced the action of GABA on postsynaptic GABA-A receptors expressed by pallidal neurons. High densities of zolpidem were also found in the substantia nigra pars reticulata, which is an important output center of the basal ganglia circuit. However, little is known about interactions of zolpidem and other Z-drugs with dopamine neurotransmission in the basal ganglia. In other studies, it has been reported that zolpidem, acting at the benzodiazepine site of GABA-A receptors, decreased dopamine utilization in rats. Amphetamine produced GABA and GAD1 deficits in limbic structures of the rat brain. The effects of zolpidem observed in this study, as well as previous studies, may reflect its ability to modulate dopamine transmission by acting at the alpha-1 containing GABA-A receptors expressed in the basal ganglia.
Limitations for the study include variability and locomotor activity of the control groups in the open field experiments, and other typical limitations.
So the conclusions found by the people who wrote the paper are as follows. The non-benzodiazepine GABAergic medication zolpidem differed substantially from that of the benzodiazepine derivative diazepam in the models of psychosis. Zolpidem modulates GABAergic mechanisms, having a relatively selective nature for the alpha-1 containing GABA-A receptor. Now you may be thinking, some of those words didn't make a whole lot of sense. And I thought the same thing when I read it many times. And I had to look up a lot of those words. And they still don't make a whole lot of sense. So, my opinions on this journal is that, I guess it's cool that they compared non-benzodiazepine medications to benzodiazepine medications for antipsychotic-like effects. However, they couldn't have made it at least a little bit easy to figure out what they were talking about. Like, come on, man. Also, for having a title like antipsychotic-like effects of zolpidem in Wistar rats, you would think they would only talk about zolpidem, but no, there were 3 drugs involved, and that upset me.
Yeah, fair enough.
Any thoughts on your end?
I don't know. I didn't think this was the most moral study ever.
Fair.
Especially because they're just giving these rats amphetamine and then depressants until they basically have seizures, stop moving.
That wasn't great.
I think if this study had more profound results, like maybe they found that zolpidem was like a way better way to treat and schizophrenia, it may turned out differently, but I'm not sure.
Yeah.
Torturing these rats,
I think
it's worth it.
I definitely agree. Like, the whole causing ataxia and everything's not super great. But I also think that it opens a door for further study about, other non-benzodiazepine treatments for for psychosis, which is cool, but also at the same time, maybe don't give 30 milligrams of amphetamine to a rat and see what happens. That's not super cool.
Just seems weird that we're measuring these drugs based on like how many stimulants and depressants we can mix until they have seizures.
Yeah, that was kind of weird.
But I don't know. I guess it's how all of our drugs get made.
Yeah. Also, other limitations, like, what if your rats were just feeling lazy that day?
Yeah.
And they just didn't feel like running around. And then you just, inject them with some more whatever. Like, that could cause some issues, Even if in the baseline test, like, maybe they just weren't feeling it.
Yeah, you might not have a good null sample.
Yeah. So, things
Never
to
know.
think about.
Yeah.
Things to think about. Thanks for coming to the philosophy talk.
Oh boy.